We're recording this mainly because we want to be able to critique ourselves later.
Okay.
So several of us have in our men's group. We sit around and talk about a lot of things, and many times our conversation is drifted into healthcare services. Most of us in the men's group are vets, or George is a spouse of a vet. I mean, Alana is a vet. And we've just talked about a lot of services and what you can get. So we thought maybe we ought to just put together kind of a primer on what is the VA and what kind of services they provide and to what kind of people, just to give people some information so that they can maybe say, oh, I ought to look into this. So we decided to put some stuff together, and what we're going to do is go through a pretty high-level overview of veterans' benefits and services through the VA. So, the Department of Veterans Affairs, which is part of the United States government, the Secretary of Veterans Affairs is a cabinet-level position within the administration. The Veterans Administration goes way back to about the Civil War, when Lincoln was very involved in saying we need to provide services to veterans of war, especially veterans that have been injured. So the Veterans Affairs kind of does a number of things, but you can look at it as they have three main areas that they provide services. There's three main departments that cover these things within VA. They provide lifelong health care to eligible military vets. And we'll talk about what that eligibility means, but they do that. They have a lot of non-healthcare related benefits, some of which you know about, like VA home loans, training, college tuitions, stuff that's covered by the GI Bill, a number of those things. And of course, then they do provide burial and memorial services, benefits. And so we'll just talk briefly about that. So the Department of Veterans Affairs, like I said, it's their job is to provide health care, education, disability, funeral expenses, services, financial aid, a number of things if you're a veteran of the United States Armed Services. The three main departments that do that are the Health Care Department, the Veterans Benefits Department, and the National Cemetery Administration. Plus, here in California, the California Department of Veterans Affairs has additional things that they provide over and above what the federal does. Okay, so healthcare services it's the largest integrated healthcare system in the country, the VA. Over time, there's been a lot of issues with that. During the Trump administration, Trump made a lot of changes that improved the VA and their service, the services they provided. Quality went up significantly. I'm not sure how much of that is continuing, but there's certainly that. So there's all these other benefits that are geared towards transitioning people from active duty to being out of the service. So there's a lot of things like college tuition under the GI Bill, buying your first home, a lot of things. There's employment services that are available. A lot of stuff that's out there. The National Cemetery Administration. So there are veteran cemeteries all over the country. This is one that I personally used when my wife passed away. She's interred at the cemetery where I will be one of these days. So that's, we'll talk about that a little later, but there are services there and they're very good for people who want to avail themselves. So as far as benefits, I'm going to kind of highlight here some of the kinds of things the Veterans Administration provides. After that, we'll talk about eligibility, because that's the key, whether you're eligible for things. All right, so there's the health care, which is basically anything you get from any health care provider, system, insurance plan, Kaiser, whatever. The VA does all the same stuff. We are very fortunate here in Sacramento, being a pretty military town in the past, where we have a lot of VA services. At McClellan, Mather has a full hospital services. McClellan has clinics. There are a lot of services right here in Sacramento, plus in Fairfield at Travis Air Force Base, at Beale Air Force Base. Services that veterans can avail themselves of. So, healthcare stuff is basically everything you see in a normal healthcare system. There is disability compensation. If you are disabled, if you were disabled as a result of your military service, or some condition later that gets exacerbated because something happened to you in the service, you are potentially available for compensation. That means a monthly cash payment. What type of disability you have and a variety of other things determines how much. It can be as little as $100 a month to up to $3,000 a month, depending on your particular situation. Okay. As far as the other benefits, like education and training, I'm a vet. I use my GI Bill. I went to college. They paid me so much. Couch, did you avail yourself of any of that?
I went to a trade school.
Okay. So there's all kinds of training and stuff, and the VA will provide services. Those programs will compensate you for that. When you get out, you're supposed to be told when you get out. Several of us have talked about this, and we don't remember having this conversation. But when you get out of the service, they're supposed to tell you to contact the VA when you're getting out, so they can tell you all the things that they're ready to help you transition into civilian life. I don't remember that back in 1968, being told that. But supposedly they do that. Couch doesn't remember them having that conversation in 2001. Okay, so there's those services, training, career stuff. They provide those things. There is a pension program, which is separate from the disability compensation, a pension program for wartime vets that qualify for a pension. And it's based on income, a number of criteria they use to determine, number one, if you're eligible, and number two, how much you get. I happen to be in this particular program right now. There's housing assistance. So supposedly there certainly are loan programs. VA, which has home loan programs, and CalVet, under California law, has another program. So there are two separate programs you can actually use both of them, not at the same time, but you could use both of them. VA does provide you with a mechanism to get access to all of your military records. It's an easy way to get, did I have malaria back in whatever? Anyway, you can get access to your records through the VA. When you get out, for a period of time after you get out, you're eligible to buy life insurance through the program. It's kind of a discounted, there's a time limit. I don't know what it is. Maybe it's either 3 or 6 months after you get out to avail yourself of that. VA burial and memorial benefits. If you are a vet, you are eligible, if you're a vet, and when we talk about a vet, we're talking about anyone who is discharged, anything except dishonorable. So, if you're a honorably discharged vet, there's actually a process you can go through to appeal that. But basically, if you're dishonorably discharged, you're not eligible for any of these things we're talking about. So, there are burial benefits. As a vet, you are entitled to be interred in a veteran's cemetery at no cost. And the spouse of a vet.
Is cremation an option?
Yes. Yeah. Okay. When my wife passed away, I had selected to have her, and she wanted that too. We're going to be interred at a veteran's cemetery. I paid for the I paid for the mortuary services, including cremation costs. So, VA provides you with a plot and a headstone, basically, and certain memorial services, honor guard, flag, various things. Okay, so they don't do the cremation, but they do the internment, and they're great to work with. It was a very easy process. It's a beautiful place. Anyway, I have nothing but good things to say about that particular program. All right, so there are also benefits that they provide for service people who are currently in the service. So there are a whole set of services, including some services available to National Guard and reserves. Generally, it's if they are or have been deployed under a presidential order. In other words, they were called up to service. Doesn't include if you go off to training for 2 weeks. That doesn't count. But anyway, National Guard and reservists can be eligible for that. There are also a variety of services available to spouses and dependent children. Some of these services are available to those people, not just the veteran, but the spouse and dependent children. Key dependent children. Let's see. So there's those things. Okay, I guess the other thing is that most people don't realize that if you are a caregiver, family member, or not actually, if you're a caregiver to a veteran who has a service-related disability, then that person can be eligible for benefits also. Okay? All right. So eligibility is the hardest thing to understand with the Veterans Administration. So there's some basic criteria for being a eligible vet. So like I said, Basically, if you served in the military and you are anything except honorably if you were dishonorably discharged, I gotta figure out a way to say that, Couch. I get it confused. Condition other than dishonorable. Okay. You may be eligible for all of these, any and all of these benefits. Okay. The key here is may, because there are other criteria that you have to think about. So, like I said, here in Sacramento, we're really fortunate that there are a lot of veteran facilities and stuff available in Sacramento. If you were in California up in Susanville, maybe not too much. If you're in, I don't know, somewhere in remote Idaho, or there may not be as many services available to you locally. You may have to go somewhere to get those services. But here in Sacramento, we have lots of services available to us, and there appears to be good staffing. So you don't wait unusual times.
One thing to add, if you have to go to a specialized hospital, the VA offers transportation.
Yep, they cover travel expenses.
Yes.
So,
Lodging, food,
yeah.
transportation.
But it's key that you're in the system. So, but you have to think about, so you have this basic criteria that says, I'm a vet. But then look at that the Veterans Administration, they prioritize services. What services you're eligible for, maybe how quickly you get access to those services based on this triage prioritizing of the veteran. That only happens if you apply for VA health care and they do an assessment of you, an exam. Then they determine your physical status for health care, and your records determine all kinds of other things that go into it. And we'll talk about that just here for a couple of minutes that maybe make it more clear. So like I said, the priority group is what they use to prioritize things. And just an aside, from a federal funding perspective, there's a lot of things that affect a given area's ability to provide certain services. So certainly it's what services are available, how much funding is allocated, how much staff they have. There's a lot of factors that go into, if I have a certain condition and I need it taken care of in Sacramento, maybe I can get in a week or whatever. I'm not talking an emergency. But if I'm somewhere else, I may have to go somewhere and I may have a longer wait time. That's all depending on all these other factors. So, but the key is that the VA sets what priority group you're in. So just to talk to these groups, basically they're going to look at your military history, your disability rating, which comes out of this healthcare screening, if you will, your income level, household income will determine what level of service you're going to get. Which, for example, whether or not you qualify for Medicaid, or here in California, Medi-Cal, which is welfare support, on food stamps, or a number of things might change your eligibility or up your priority. So basically, veterans who are injured in wartime, in combat, or during their military service get the highest priority, which is the way we'd want it. Disabled vet is going to get the highest priority if they signed up to serve in our country and during that service you're injured, then you should get the highest level of support. So the priority groups, just to cover these real quickly. So group 1, which is the highest level, and if you have a service-connected disability and they rate you at 50% or higher disabled, Couch is more of an expert on this than I am, but different things that you have wrong with you give you different. So if you got diabetes, what's that? Do you know? 20% disabled? If you have sleep apnea, if you have hearing loss.
So hearing loss starts at 10%. There has been some changes made to sleep apnea, but originally that was a minimum 50%. But if you have multiple problems, it's not just this is 1%, this is 1%. There's ways.
There's a formula they go through. So they kind of weight things. So you get this, then you get, let's say you had a 20% disability, and then you get another item, you have another item that's 20% disability. Well, cumulative of that, maybe only 30. They have a formula that they go through. But the key here is all these things have to be service related. So I have sleep apnea, I have hearing loss, I have a number of issues, none of which, as far as I know, are service related. Couch has some ailments that are being dealt with that are, he's working on this, but we're pretty sure some of those things are service related. That will affect the level of care he gets in the future if we deal with that. So basically you got to be 50% or higher disability rating. The other people that qualify automatically is Medal of Honor winners. If you're a Medal of Honor winner, you're automatically priority group 1. So.
What if you're an amputee?
Well, that's a type of disability. An amputee, if it's service related, is. I've looked at that stuff. I'm not. It depends on the amputation and the remediation. If you had a part leg and you've got a prosthetic, it may be a different rating than if you have an amputation and you can't have a. I don't know. There's differences, but absolutely, if you got an amputation, if your amputation is due to combat, you're absolutely, almost guaranteed you're going to be a priority 1. Okay. If not priority 2, the only difference between priority 2 is the level of. So if I had 2 people come in, they both had needed services, the one with priority 1 gets looked at first, and then the other person. That's just basic how to look at it. So if there's a lot of service availability, there's doctors available and facilities available, you're going to get taken care of pretty quickly. Okay, so priority 2 is basically the same as priority 1, just less disability. Priority 3 is the same way, except now if you've been a POW or you're a Purple Heart recipient, you also qualify for these. So there's each of these, as you go down, there are other things that affect you. You supply the information to VA that they use to make these decisions. You don't say, oh, I'm a priority 3. They're going to tell you what priority group you're in. I get services from the VA, and I don't know what priority group I am. Couch doesn't know either.
I've been told at the hospital my mom's a priority 8.
They told her she's a priority 8. Okay, we'll get to that in just a second. Okay, so priority 3, priority 4 is basically veterans who that need services at home, provided services. That's called aid and attendance, and that could be a money benefit. So that can move you into priority 4. Priority 5 starts getting more into the income, but if you're in a pension program like I am, then I'm in priority 5, but there's something else that put me there. So if you're priority 6 really kind of deals with veterans who have certain, if you serve during the Gulf, if you're a Persian Gulf veteran, or if you are a Vietnam era veteran like Frank in our church is, who is exposed to Agent Orange, he falls into this group because he gets services. So if you're exposed to radiation, a whole bunch of different things can put you in category 6. You hear a lot of things advertised today. If you're a Camp Lejeune veteran, well, there were some toxic issues in Camp Lejeune, and if you served there, you were exposed to bad stuff in the water. If that's documented, you're in priority 6. Priority 7 is veterans that have a certain financial household income level. If you're below this adjusted VA income level, so depending on how much money you bring in, if you don't bring in enough money, you can be a category 7. Most veterans who don't have a service-related injury make money over this minimum amount are priority 8. Okay, so your mom may be in priority 8. You'd have to look at her data to see if she could be something higher than priority 8. There be anyway, so that's what priority 8 is. So within priority 8, there's all kinds of other subcategories and lots of detail, which we're not going to get into, but most vets are in most people that have served in the service, almost 2 million in California, are probably going to be priority 8. But so this is just to show you an example of, based on the priority group and the type of service, whether or not you have a copay. So if you're a priority 8 and you go to audiology to have your hearing tested, and they determine that you need hearing aids, if you're a priority 8, they're probably paying for the hearing aids, no cost to you, but you're going to pay a $50 copay for the doctor visit. Okay? So there's a lot of, like, if your mom had a hearing loss, she can go in and get her hearing tested. If they prescribed hearing aids, she's going to get hearing aids at no cost, probably, except you're going to pay for the $50 for the doctor visit or the audiology appointment. So there's a number of those things. So based on your priority, this just kind of gives you a look-see of what's no cost and what may have a copay. All right. So if you want help, there are a number of ways to get help. Certainly you can contact the VA. There's a lot of information online. Their website's really good. It's got a lot of stuff. Some of it can be confusing, but it's there. CalVet, the California Department of Health Services or Veteran Services, has their website. They have a lot of stuff there. And at the county level, there's a county office of Veteran Services, which is just up the road from where you live. I think you guys still live in the condo?
Not condo, it's just a.
Townhouse or whatever?
Yeah, townhouse.
Yeah, whatever. I've been there once, I think. Anyway, right up Norwood,
Yeah.
just before you get to the freeway where all the bunch of county offices, that's where the Veterans Affairs Office is for Sacramento County on Research Drive. Anyway, you could go there. Then you can also get a lot of information from the American Legion, Veterans of Foreign Wars, Couch?
Purple Heart.
Purple Heart, so there's Association for Purple Heart recipients. And then it's important to note that there are some private organizations, maybe they may or may not be nonprofit, but private organizations that specifically help veterans get benefits. Most of those have a fee. A lot of them are like lawyers who say you had a car accident, you don't pay unless we win, kind of thing. They do that. In other words, if they get you some benefits, cash benefits, then they get a fee. It may be 1-2 months. I think they just told me my blood sugar is high. Anyway, so any questions? High glucose. Was that pizza I just had? Okay, no questions? Couch, anything I missed? It's pretty fast.
Yeah. Just that the different groups, they're commutative. They add up.
Yes.
So if you have something and then later your injury or whatever gets worse or things like that, your financial situation changes,
You
can
may move up.
or down the different groups. So it's always good to keep up on that information and check to see if you've moved, because that could add more benefits in your favor. Not only financially, but physically as well.
So for example, I'm not sure that when you get classified as a group 8, which says you don't have a service-related disability, but you're eligible for health care services. So the only thing that makes you 8 is your income. It's saying that your household income is over a certain threshold. In other words, they think you can afford to pay, so you're going to pay. In the case of VA, you're going to pay a pretty low copay, actually. So, but your financial situation can change for a variety of reasons. Number one, they sometimes raise the threshold, and it's geographically adjusted. So Sacramento has, California has a different higher rating generally than most places. Sacramento may have higher. Anyway, so it's adjusted by that. But it also, there's all these things that you're allowed to deduct that most people don't know. If people are providing you services, that comes off of your income. So you might be dropped down to an area where you're priority 7. Here in Sacramento, I'm not sure how much better your services would be if you're a priority 7 versus an 8, because we're just pretty good here in Sacramento as far as availability. So,
an example for like myself, So typically, the VA does not offer eye care unless you are 100% disability. The caveat to that is if you're diabetic and the diabetes is deteriorating your eyesight, then you will qualify for eye care, and they will check your eyes annually. They'll give you new prescriptions and glasses every year. So you go get checked out. If it's gotten worse, they'll change your prescription and they'll give you free glasses. But there's other illnesses that may move you up and down on what you qualify to receive from the VA healthcare system.
I think the advantage of those private organizations is when they look at your data as far as your when you served, where you served, all that stuff, and what kind of job you had. They are really good at saying, your hearing loss may be caused because you were in the motor pool and deal continuously with a beeping phone. But I mean, yeah, so those things are always good to look at. So there are people who really are experts at kind of saying, that may be job related. So I was in a computer room. If they ever determined that the hum in the computer room was probably harmful to my hearing, then maybe that would be eligible. But just to give you an example of the difference between going through VA, if you went to VA and you were eligible and you got glasses from VA versus when I was with Kaiser. So Kaiser, I've got a senior, I get the best Kaiser plan. And so I get new glasses every 2 years and I have a $400 deductible. So whatever my glasses cost, up to $400 they pay. If it's over $400, I pay the difference, right? VA, $0. When I was with Kaiser, I got hearing aids. My deductible was $800 per ear. Deductible. VA, $0. And they provide the top level as far as quality is concerned. VA provides the best stuff available. Anyway. Okay. Nothing else?
There are certain things, like for your eye care, if you want bifocals or trifocals, whatever, they'll do that. If you want something like transition lens, you do have to pay extra for that. Or if you want a duplicate of your prescription, so you have 2 pairs of glasses at all times, you have to pay for the second. But your initial ones are free. And depending on...
And the other ones are cheaper.
Yeah, and depending on how you want, like I said, I went from having a single lens to a bifocal. It didn't cost me any extra. They just, whatever you're comfortable with, and they'll make that happen. And my prescription was filled for free, and they give you an option of frames to choose from. Those are all free as well.
Yeah. So in the case of your mom, let's say she doesn't know whether she needs hearing, wants to get her hearing tested, I'd call the VA, make an appointment. It may cost you $50, maybe 0. If you want to have your eyes checked, call, see if they'll take you. Because that's how you find out a lot of times whether or not she's got her VA health care card, she's in the system. So there's a number you call for health care, and I called, made an appointment with audiology. They scheduled me for a hearing test, checked me out, said, yep, you need hearing aids. Showed me the ones, picked the ones I wanted. 30 days later, I had brand new hearing aids, zero cost. So, with me, I had a lot of issues, heart issues and stuff. So, and when my wife was alive, I had Kaiser because it was she and I. And, I've always had good service from them. But the VA's benefits are good. I've not had any bad luck. And things are, my drugs through Kaiser was almost exactly the same cost it would be through VA. So VA has most of their drugs generic, it's nothing. Some you have a copay, but it's a good program. Okay.
Another thing too is depending on what you're going to be seen at the VA for, if they are backed up or overloaded, they will send you to a non-VA,
Potentially, yeah.
potentially.
Yeah, that's another change that Trump made, which was if the VA doesn't have the service you need or there's nobody available right now, they can send you to a private doctor.
They pay for that. And then, like for me, I'm doing this right now. I have to go to a non-VA eye doctor. The VA's paying for that. Whatever prescription they give me, I take back to the VA, and they'll still fill it for free, just like if I had been with them the whole time from start to finish. So that is a new option that wasn't available for a very long time. That now, if they get overwhelmed, they can kind of freelance you out to a...
Yeah, and it's their option. So if you have a need, I think if you're a vet and you're in the system, you ought to be in the system. If you're in the system, then you ought to try them. All they can do is say no, that you're not eligible for this, or, yeah. But anyway, all right, we're through. Thank you, Victoria.